Hi. Having a bit of a technical nightmare here. Oh gosh. Right. We are going to have this conversation. It is going to work. And this thing, this Facebook, is going to do what it should do. Because it should be really straightforward. Oh God. Hi Claire. So we're going to be talking about how to choose your practitioner, how to decide who you would like to have your aesthetic treatments with, skincare treatments, and okay, I am having a complete nightmare here. Right, that is going to disappear down there. We'll put that back up. Okay. Right. Okay. Right, we will hopefully this is going to keep still now, and we're just going to stick with Facebook and not go over to Instagram. So how to choose your aesthetics practitioner is what this whole live is going to be about, and I have never done a live where I've invited somebody else into the chat before. So we will just wait for some people to come online. Have you, ask in the comments below if you have been looking for aesthetic treatments, whether before lockdown, before massive technical itch, before lockdown or during lockdown, if you've been looking at aesthetic treatments, and all of the things that come into your mind about what is most important for you to find out about a person when you're going to have treatments with them, whether it's skin treatments, beauty treatments, aesthetic treatments, health coaching, weight loss. What really is your biggest priority when you're want to choose somebody to have any of these kind of treatments? And it could just be it could just literally be what cleanser is best, or what serums are best, or if you've got pigmentation or wrinkles that you want to have treated, anti-aging concerns, what can you eat, how can you change your lifestyle. All of these things are really important when you're thinking about skin health. But who really has all of that knowledge, and who would you like to speak to about it, and what makes you choose that particular practitioner? So I wonder if you can tell me in the comments what is most important for you when you're choosing an aesthetic practitioner. If I was going to go and have aesthetic treatments anywhere, then I would be thinking about what these to get to the clinic. So I'd want to know where the clinic was in relation to where I live. I'd want to know that I could go there if I had an issue or a problem. I'd want to know that it's fairly easy for me to go there because, you know, if I have a good treatment and a good experience, I'll probably go back to that clinic again. So I don't want them to be too far away from me. At the same time, I'll travel for a good treatment and a safe treatment. So location is obviously really important because you need to be able to get there. Reputation, thank you Kate, reputation, recommendation, qualifications and experience. So reputation, I'd be looking at their Google reviews, I'd be looking at their website, and I'd be looking at their reviews, and I'd want to know that those reviews were absolutely genuine. Reputation, recommendation, so yeah, obviously word of mouth. If you've got good friends and they've told you about treatments that they've had and they're really good treatments and they're happy with the experience and the service they've had, then obviously that's going to be a winner. So ask your friends if they've been there or if somebody's recommended somebody to you. Qualifications and experience. Now that's quite a subject when you're thinking about aesthetics. So qualifications, if I tell you about my qualifications a little bit. So I'm a registered nurse. I qualified as a nurse in 2001. And then after I qualified as a nurse, I worked in theatres for a long time, and then I went into A&E and I worked in trauma. Then I went back into theatres, did some midwifery as well after that. And then I went out into primary care, and primary care being a GP practice, and I focused on the urgent and emergent care. And then I trained to be a nurse practitioner, became an independent nurse practitioner with prescribing. And then I went into leadership and management, and during that time I also trained in aesthetics. So I trained in aesthetics in 2008 in London, and that was actually in Harley Street with Kate Goldie, Dr. Kate Goldie, who's one of the leaders in aesthetics. And that wasn't enough for me, so then I went to do advanced treatments with Medics Direct. And I wonder why I can't see Sian on here. but I can't see Sian. Then I went into look at more skincare and skin health and learned how to do skin peels, and kept studying, kept doing lots of CPD, attended lots of conferences, lots of one-to-one training that I did. And then I went to become clinical lead for the out-of-hours service in Norfolk. And I took a step back from aesthetics for a little while, just for a couple of years, had a baby, and then I did want to go back into aesthetics, and I decided that if I was going to go into aesthetics, that I would do the best possible course that I could find in aesthetics, and that was a master's degree purely in aesthetics, and that has taken 4 years to complete, and that was with the University of Northumbria. So that's education from me. If I wanted to go to another practitioner, I would want to know that they at least had the medical background, and that they had done lots and lots and lots of aesthetic treatments, and especially the aesthetic treatment that I go to have done if I went to see somebody. For example, if I went to have thread lifts, I would want to know that they had a lot of experience in threads. If I wanted to have eye treatments, I would want to know that they were exceptionally experienced and knowledgeable about eye treatments. So here comes Sian. It's adding you, Sian. It's been a technical nightmare for me. Hi.
Hi. Oh my gosh, I'm so sorry. I don't know whether it was my end or your end. What was going on?
I kept pressing the green button. I kept pressing it, and every time I pressed it, it said connection error. So I'm so sorry.
And then I couldn't find you. I wasn't getting your notification, so I went looking, and then I was like, oh, she is live. I came and found you.
I couldn't find it. I was on Instagram and on my Facebook, obviously on the same page. But they're both side by side, and it just wouldn't do what I wanted it to do. So sorry, but here we are.
Hi. Hello. I assume you've already sort of cracked on with the introduction part of everything.
Yes.
What we were going to go through. So just to say hello to everybody that's on your page here, I'm Sian, I'm a skin and beauty therapist, and I wanted to grill Victoria here about her aesthetics business. Basically, it's not a side of the business that I've been involved in, but it really interests me, and it's fantastic for me to find out a bit more of it from you, Victoria, in order to be able to also advise my clients when it comes to them wanting to go in that direction as well. So it's really nice to be able to have this opportunity to pick your brains a little bit.
It was lovely for me. Thank you very much.
Yeah. So I know that I don't know anything even really about your side of the business, Victoria. What was your background? I know you might have already gone through this with your clients that you're on here now, but what was your background into the industry?
Well, I trained as a nurse, and I qualified in 2001. And initially I was a theatre nurse. So I started off in gynecology, general surgery, and then I went into the emergency team, and I worked in recovery and the emergency team. So we kind of,
oh wow,
we were on call most of the time, and so we did shifts, but then we were on call, so we would manage the patients as they came in, all kinds of emergencies, as well as medical emergencies sometimes. And then I was in recovery, so I would be the recovery part of that team, as well as because I worked as a scrub nurse and as a circulating nurse, so we did all that. Yeah. Then I went into midwifery, and then trauma, A&E, and worked in A&E for quite a while, specialised in trauma in there, and then I went into primary care, so the GP surgery. But because of my background in A&E, I did lots of urgent care, so then I went into out of hours, so we could do primary care and urgent care, so it was all very interesting. But aesthetics wise, because my mum was a hairdresser, so I grew up around beauty, and I've always been interested in beauty and how nursing could, kind of complement the whole thing. So when I was invited to train in aesthetics in 2008, I jumped at the chance because I loved it. So I trained, and then I went into more and more advanced training, and then I've just come to the end of my master's degree for non-surgical aesthetics.
Oh my god.
Yeah, so it's been a huge learning curve in aesthetics, because that it's an unregulated industry. So with all of your nursing background, you're always constantly thinking about the patient first, and confidentiality and consent and everything else that goes along with that. So you're even though you're working in a slightly different industry, and you've come out of the NHS, you're still a nurse, so you still have this code of conduct that you must stick to. So that's always in the back of your mind, well, in the front of your mind, really. And how you integrate that with your aesthetic practice.
And so what's the deal with that now? What is the situation with regard to what qualifications you've got to have to go into things like injectables? Because I know at one point they did change, didn't they? Like they wouldn't allow beauty therapists to do it anymore, and they tried to put in some kind of ruling, but what's the deal with it now?
I believe that Parliament are constantly being lobbied, and we have accreditations with SafeFace and the JCCP. We have lots of groups, but the regulation still hasn't come in, so literally anybody can train in aesthetics. It's just the most important thing for people who are looking to have aesthetic treatments is that they really research the person that they go to, their background. I think when it comes to safety, because there are risks with any treatment that you have, there's no treatment that involves a needle really the way you can, or any topical cream or ointment even, where there's no risk. There's always risk, even if the risk is small.
Absolutely.
So it's really important that when anybody has any treatment at all, that they really look at the person that they're going to see, and you know, go and have a consultation, but don't commit to having any treatment. Go and have lots of consultations, speak to lots of people, and make sure that when you go to see somebody that you really trust them.
So that's the kind of things you want to be looking out for, really. And when someone advertises to do this sort of treatment, do they have, like, would you have letters after your name, or do you pronounce to people that you are like a medic or a medical nurse kind of thing, practitioner? Is there a way to sort of separate yourself from the maybe people that aren't so advanced experience wise?
I think there's lots of experienced and advanced people out there who are not necessarily accredited. But if I was looking for an aesthetic treatment, I would want to know that somebody had been accredited, because accreditation means that, for example, if you have SafeFace accreditation, it means that SafeFace have sent somebody out to your clinic. They've looked at all of your qualifications, checked your insurance, they've checked the pharmacies where you get your products from, they've checked that you're qualified in every treatment that you do. So somebody's already done that check for you. If you know that they're accredited and the accreditation is all up to date, then you know that takes all of that weight off. The other thing to look at, as I was saying already, is other people's reviews. And if you know that those reviews are genuine, so they're Google reviews or video reviews, then that's sort of, you know, social trust really there. And CQC registration is also important, so you know that CQC are regulating that particular practice. But that's not to say that if they don't have accreditation or regulation or CQC registration, that they're not any good. You can still do all of your own research. But if I was looking for a practitioner, I would want to know that they had the medical background, that they're a prescriber, and that they had accreditation.
What would you say would be the thing to look out for, like, you know, cowboys wise? What would be the thing to sort of avoid or to look out for in that respect?
I would want to know that I could always contact the person. So a lot of the research I've done is around managing complications in aesthetics. So I would want to know that if a problem occurred, that person that did the treatment for me, let me just say that complications are incredibly rare. These are very safe treatments. However, if something did happen that I was worried about, I would want to know that I could get in touch with that person really easily.
Because the aftercare's not always there, I guess, is it? That's the thing.
That can be a problem. Most people, the majority of practitioners will be available and they'll sort their own problems out, or they'll have a network. So a network of, say, ACE, which is the Aesthetics Complications Expert, or the Complications group that has just started, CMAC. So there's, you know, having that network behind them. I mean, you and I are both in aesthetic entrepreneurs, and we have the Aesthetic Entrepreneurs Clinical Group. So, you know, even that network is incredibly useful for practitioners, especially when they're new. So, you know, that builds trust in an aesthetics clinic or a beauty clinic. Cowboys, I mean, mobile practitioners can be incredibly good as well. So lots of people, when they start out, they're mobile. But I'd want to know that I can contact that person. And to avoid cowboys, really it is about checking their experience, qualifications,
making sure that they have got those reviews in place and they've got you know, some kind of background kind of thing. And what do you deal with anything? Because I know a lot of people now are going abroad to have these like cheap treatments and things. Have you come across anyone that's sort of come back from there with any disaster stories or anything like that? Are you seeing much of that in clinic?
I personally haven't. I think I'm quite lucky. I live
Yeah.
I live in rural North Norfolk, and
Right.
my clinic is small in comparison to somebody who might be in London or
In the
Cambridge,
city,
for
yeah.
example. Yeah.
Yeah, yeah.
But I think as speaking to people as part of my research, people do have treatments abroad, or even, for example, somebody might go up north or even move to a new area, and then
Right, right.
you can have issues with treatment sometimes, you know, 6 months later, where maybe you don't like the look of it anymore, or maybe you had a lip augmentation that you don't like now because it's too big and you want it reduced. So that can happen.
Yeah.
I've personally never come across somebody who's gone abroad to have a you know, big treatment and then come back and said, oh my God, please help me. I've not come across that, not yet,
Right.
but
Okay.
you know, the
Yeah.
treatments are all on the
Probably
rise.
doesn't. Yeah, yeah, yeah,
It may well
sure.
happen at some point.
And then, so if you, when you come in, so when you, someone was to come in for a consultation, what kind of things do you like focus on in a consultation or go through? Is it quite led by you, or is it quite led by the customer, or you know, or the client, or how do you go about it?
Well, because I'm a nurse and my background is nursing, and you know, especially for the last 15 years of my nursing career, it was all about the main part of everything I do is all about consultations, and whether I was in the NHS, in primary care, urgent care, or in
Yeah, it's all about the
aesthetic,
back work and the.
it's everything is all to do with your consultation, and consultation goes on. You don't just have it once; it goes on with every appointment that you have, or
Right.
even you know, online, for online consultations. I always want to know what the biggest problem is, and I want to know how I can help that patient with the problem. Because if I focus on the biggest issue that somebody has, because what they tell me first most often is the thing that they need most help with.
Yeah.
And so we'll explore that first problem, and then we'll try and find some solution around it. I also want to know about their medical history, any aesthetic treatment history. I need to know about any surgical history, obviously, because if they've ever had surgery or trauma to their face, then it can impact on aesthetic safety, aesthetic treatment safety. Obviously, allergies, pregnancy, breastfeeding. More recently now, with COVID, we are discovering potentially that COVID can increase risks of inflammation, and
Oh,
especially for
really? Like
aesthetic
reaction?
treatments. Yeah.
Yeah.
And with the vaccine, so you know, we're going to have to know about any COVID infection and COVID vaccines, and that's going to possibly mean that we need to
Kind of
delay
risk assess
treatment.
it. Yeah.
Yeah.
Yeah. Yeah.
All,
Wow.
yes. What else do we need to know? Lifestyle. So when you're thinking about skin treatments, you want to know why somebody may have aged differently to somebody else. You're also thinking about sun exposure over the years. Obviously, if they've had any cancer treatments, because that can impact the
Yeah, of
fat pads
course.
in the
Yeah, yeah,
skin.
yeah.
What else would we
Is
like
that
to know?
still cool
Yeah.
though? If you've had cancer treatment, like do you have to? I assume obviously, as with in any of our industry as a whole, you have to wait certain time after treatment and things. But does that normally cause any complications? Is there anything major that normally causes complications, especially with injectables?
Autoimmune disease can.
Ah,
Autoimmune disease is not necessarily a contraindication. It depends whether or not the disease is controlled and what the disease is.
yeah.
It increases risk of possible complications,
Okay.
and those are inflammatory, usually inflammatory reactions. So managing expectations, managing risk, and you know, sometimes people aren't. It's not appropriate to have a treatment, and that can happen.
Yeah, yeah, for sure. And then, so what's the sort of thing do you consider before you sort of come up? Do you, when someone would come in, would you then design a course of treatments for them then to sort of just sort of, you sort of go through their concerns and you design that treatment course? And I assume that can probably change over the course of treatments as well. But was that what would go on, that you'd sort of decipher what you would do throughout a course of time?
Yeah, so we'll identify what the problems are, and we'll identify why those problems exist. So if somebody has oh, I'm looking at myself now. But if somebody has nasolabial lines, or
That's
perhaps
a really common one. I find that so
yeah,
much in clinic. This is like the one that really people start to notice quite early on, is as soon as you start to get your nasolabial
yeah,
lines coming in, that people want that volume brought back in or
yeah.
whatever.
Often people come in and they think that they'd like to have these areas treated, but actually if we treat the cheeks, actually you get a much nicer result, and you can improve the
Oh,
contours.
right.
These can tend to lift and
Yeah.
soften out here, because people tend to flatten here and flatten here and flatten under the eyes.
Yeah.
When you pop some filler in the I say pop some filler in the cheeks, it's not that easy. But when you
Yeah.
actually improve the contour and across the cheek, over the
Yeah,
cheekbone,
right.
across the malar fat pads, actually you
Yeah.
get a much nicer, much more natural result.
Right, yeah, of course.
So
Yeah.
you might come up with, I'll always explain why somebody has these lines or these lines or these lines. I'll always explain the anatomy behind the aging and the reason that somebody, so if, for example, if I have twins, they may look slightly different, and one twin may be slimmer or may have had more sun exposure than the other, and twins are really good at kind of comparing themselves to each other.
Yeah.
So it's explaining why they're slightly different,
And it might not be the
or
same.
yeah, and explaining about the ligaments and fat pads in the skin and how they all age over time and what the difference is, and actually then how the treatments work.
Yeah.
So I'll explain everything, and I'll explain everyone's options for treatment. So it might be a little bit of, it might be Botox, it might be fillers, it might be PRP, it might be nothing at all. It could just be skin peels or microneedling. There's so many options.
Yeah, yeah.
And that's one of the reasons why it's really important to have a consultation, to share all the information, understand the patient's problem, and then come up with a plan with the patient and give the information, and then go away and think about it.
Yeah, exactly.
You
Because
don't
it's
make
that.
any commitments at that point. Just,
Yeah, because it's
just
the
wait.
truth. Yeah, because sometimes it can take, it's not just like exactly like you say, it's not just one thing, is it? It's like addressing, the different factors of it, but also you have to take a holistic approach, don't you? Because I know that, years ago when injectables first started becoming really popular, that it wasn't so driven to have that holistic approach as far as like skin conditioning as well. And so, I still have clients coming through now that have had injectables, but they don't necessarily look after their skin at all. And so actually, although they haven't got these sort of like fine lines or wrinkles or anything, their skin conditioning is really quite bad. So yeah, is that something I know that you, because Lumiere MD, right, that you were with, which are a fantastic brand, absolutely fantastic brand. So is that the kind of approach that you take, I guess?
Yeah, and sometimes patients think they'd like to have some filler, but actually, if you improve the look of their entire face, actually need injectables at all.
Yeah, yeah.
And sometimes, if I dare say it, aesthetic treatments aren't appropriate at all. And actually, the best thing would be to have a change to the diet or a change to the lifestyle, or sometimes even a change in a relationship. It's really about identifying what that problem really is, and not just somebody who comes in and says, I'd really like to have these lines treated, and you ask why, and then you ask why again, and you ask why again,
Get
and
to the
actually
bottom
underneath
of
it all,
things. Yeah.
it's nothing to do with these lines. Actually, there's a huge other problem that you can help with.
Yeah, definitely. Definitely. And how have you been like with opening up in clinic, like since COVID and everything like that? Have a lot of your practices had to change? Obviously, it's been an absolute nightmare for us. I don't know what, and obviously yours is a bit more. I do some invasive treatments, but not so much as yours. So have you had to change your processing? Like what's gone on in clinic and things?
Yeah, it's been a tough time. It's been such a tough time for everybody, I know. So when obviously we had to close, and then when we did reopen initially, when we were first able to open, it was a case of having much longer appointment times. Because I'm upstairs in an office building, and the front door was locked, so we had to have patients would have to phone me to tell me they were there, and from the car, and then I'd meet them at the door, and then we'd do the hand gel,
Do the whole thing.
masks, screens, face shields, apron, gloves, and then upstairs everybody has to wash their hands again. And then the hardest thing, because you can tell I talk a lot, and I talk a lot to my patients, and my patients talk to me, and trying to keep talking to a minimum to reduce the potential spread of coronavirus.
Yeah.
And then things like initially it was thought that we shouldn't be doing facial treatments, and then we could do facial treatments, but then could we only do the forehead and around the eyes? And then we were allowed to do faces properly, and then we had to introduce mouthwash protocols, keep times to a minimum again. And then the other thing you think about is potential complications, and luckily we didn't have any.
No.
I've only ever, in 12 years, I've only ever really had to manage one complication, and that was an inflammatory issue that cleared up straight away. But thinking about that, if we had to treat a complication, an inflammatory complication with steroids, then that has implications for potential coronavirus issues in the future. You know, somebody then got coronavirus. So thinking about everything was, it took a lot of effort. And all the time, all you're doing is trying to keep people safe.
Yeah, exactly.
You know, and now we went into tier 2 and then tier 4 over Christmas, so we haven't been open since Boxing Day. So it's hard, and try, you know, keep communicating with everybody, keep putting all your social media out and the emailing, but try not to be too in everyone's face, and hopefully, hopefully my patients know that I miss them and I care.
But the thing is, this is the thing. I mean, it's even with things like this, you know, you're staying in touch with your clients and people are interested in things, and it's such a great way of like educating people in other ways. And as we always spout off to people, you know, everything starts with home care. And if you're getting the education and you're looking after your skin at home and investing in it that way while we are closed, then, you know, we've got all the better chance of improving things when we're back open and getting you in for those extra bits and bobs. So I think it's a great way. It's a very difficult time for everybody, but hopefully April 12th, right, that we'll all be back in clinic.
I can't wait.
And it'll be all right. But I think that's really great. I mean, as I say, I just don't have any experience personally in your side of the industry, although it's particularly your injectables. And so, you know, I often have people ask me about it. So it's really great to be able to touch base with you and just sort of get a bit more information about what people should be looking out for, really, and how they would go about finding the right practitioner, because it is really important. And I've definitely heard of a few, I don't want to call them cowboys really, but, you know, people that are in it just for the quick buck rather than the long game. I know the industry is changing a lot, and hopefully, like you say, a lot more regulation will come in order to restrict that. But
I think it's a long time coming. I mean, there are changes going on all the time. Safe Face and the JCCP, CMAC and ACE, everybody works so incredibly hard to you know, raise standards, to raise awareness, and they really do work so hard, and they're constantly researching and asking people. People can report problems, complications, and it's not nobody wants to ever criticize anybody else in this industry. Everybody is really supportive and incredibly positive about everybody, and everybody should aim to have very high standards, and I mean I certainly do. I know you do, and keeping that bar set really high, and you know, making sure that everyone is safe and well cared for is just the most important thing. And you know, and I know you and everyone in Aesthetic Entrepreneurs has the same ethos as well. But I think it's quite easy to tell whether somebody is a cowboy or not, and I certainly would, just to summarize those particular points, so thinking about your own safety, so making sure that somebody has the appropriate qualifications, preferably accreditations with Safe Face, the insurance, making sure that the pharmacy is really important, where people buy their products, making sure that I mean every day
that's another thing, isn't it? So there obviously is a lot of different product out there now. Is there a lot of like is there a big scale? Is some of it really pretty rubbish and some of it very, very good, or is it quite regulated?
No, it's not. There are so Juvederm, Teosil, Restylane, Belotero, they're the 4 products I tend to use, and Profilo for fillers, Alonze and silhouette threads as well. These are all approved in England and the UK and Europe, so they're approved. The thing about it is I only use regulated pharmacies, so I use Church, Health Exchange and Wigmore. I don't use any others, and there are others out there. It's not to say that there aren't, but there are others. But I trust those pharmacies.
They're very good,
and I will only buy from those pharmacies. So if you do go and have aesthetic treatments, ask and find out for sure that those products are
What
from a
product you're going to
regulated
have in?
pharmacy.
Yeah, exactly. What
Every
product?
day on Instagram and Facebook and email, I get so many manufacturers or distributors trying to sell me medication, and I block them straight
I
away.
can imagine. Yeah.
Because now there are so many out there. So you do your nurse, doctor, pharmacist or dentist should be that filter between that. You shouldn't need to check that. Your regulated medics should know
Yeah,
where those
yeah,
products are
yeah.
coming from. It
They
is
should be able to
really
know and should be able to
important.
tell you straight away, like what they're
Yeah,
doing, where it's from, blah blah blah. Yeah,
exactly.
yeah, yeah, yeah. Oh, great! Oh, that's awesome. I think it's been really good. Yeah, thank you so much for like, doing this with me, and it's been really nice being on here.
No, I really appreciate your time. Thank you. I really
Oh, you're
appreciate it. Thanks so
welcome. I
much.
hope it's been good for anyone that's watching and anyone that does watch, because that's been really cool. I think it's really, and like you say, it's so important. Choosing the right practitioner is that,
Yeah,
like, you know, take your time to do that, and
yeah,
you're on to a winner, aren't you? So yeah.
definitely.
All right then. Well, that's great, and I'll hopefully we'll do another one of these again soon then, or something else, or we'll cover something else.
Yeah, if anybody wants to know anything, I mean, you just ask and we can put it all together. I don't know if I
Yeah.
can put technology together because I had
Yeah,
an issue in the
technology is our
beginning.
only
My light
problem.
kind of
All the
sunk
things we
down.
need in order to bring this to your screen is actually the tricky part.
Yeah.
All right, guys. Lovely to
Thank
speak to
you.
you.
And
Take
you.
care. See you. Bye.
Bye.